Millions of Americans and their families depend upon sound policies to help them lead longer, better lives in more vibrant communities. CityHealth, an initiative of the de Beaumont Foundation and Kaiser Permanente, provides leaders with a package of evidence-based policies that can help every person live their healthiest possible life. CityHealth rates the nation's largest cities on their progress while providing urban leaders a set of policy recommendations that align with their city's priorities and needs.
What CityHealth does is it helps city leaders say, here are the most realistic, pragmatic steps that you could take. Not hundreds of different things, but here's a really finite list. If you put this in place, you are going to help your citizens today for a much better quality of life.
City leaders are problem solvers. They don't want just big ideas. They want concrete, tactical, pragmatic solutions to address those problems head on. And that's what CityHealth is all about.
The nice part about CityHealth is you build in choice, which allows for a lot of local control. Not every city is the same, and we built in this flexibility. And I think that really empowered local leaders.
CityHealth sets a gold standard by giving cities medals to show where they stand, even as they work with leaders to find the right solutions to leverage in their communities.
San Antonio does not have a great history with regard to community health, but we have come such a long way with politics completely removed from the decision-making on what are our priorities for community health.
One thing that I know as a mayor of a city is that the decisions that we make are things that people live with for 20, 30, 40 years into the future. It all starts with prioritizing those things that are really important to the community, and community health is certainly one of those.
It's been such a pleasure to put a medal around those city leaders because it takes a lot of work and it takes a commitment to creating an environment where you know that not only your family, but your entire community, they're all going to do well if you have that policy condition and that commitment to good health.
Hello, and welcome to the 2020 City Health Annual Policy Assessment of America's 40 Largest Cities. I'm Catherine Patterson, City Health's Co-Executive Director, and I'm so pleased you've joined us to learn how cities are prioritizing health, even during such an unprecedented time. Today, we're excited to release the results of our annual 2020 City Health Policy Assessment. This is a milestone year for our city ratings report. Despite the myriad of challenges 2020 has delivered, one thing has been proven: cities are resilient. This is the fourth year that we have evaluated America's 40 largest cities on the strength and number of policies that they have in place to help every person live their healthiest life possible. But first, I want to give you a little bit of background. For those of you who are new to City Health, we're an initiative of the de Beaumont Foundation and Kaiser Permanente. We work directly with cities to advance a menu of policy solutions that are backed in evidence and have been proven to result in better health and build more prosperous communities. Our policy package focuses exclusively on upstream policies that are designed to help prevent health problems and improve overall community health and outcomes for city residents. Our goal is to provide city leaders with pragmatic, achievable, and some aspirational policies that align with local priorities and needs. City Health's 9 policies are designed to address the social determinants of health, along with key preventable causes of death and disability in education, environment, financial security, housing, nutrition, public safety, tobacco control, and transportation. You know, we're seeing cities prioritize health even in the face of the COVID-19 pandemic, extreme economic uncertainty, and deep divisions among Americans. From the coast to the heartland, resilient cities are taking meaningful action and finding innovative solutions to protect the health and well-being of their communities. This local action has resulted in significant milestone achievements in this year's annual ratings. I am very proud to report that for the first time, 90% of America's largest cities have earned an overall medal. That's 36 out of 40 cities that have earned at least 4 individual policy medals. You know, when CityHealth completed its first inaugural assessment in 2017, less than half of the nation's largest cities had actually earned an overall medal. Since then, CityHealth has worked directly with city leaders, policymakers, and health officials to expand adoption of our policy package. Honestly, the results speak for themselves. The number of cities earning overall medals has grown every year. And again, today, we're proud that 90% of America's largest cities have earned an overall medal. But even more importantly, we're impacting the lives of millions of people that live within these communities. Today, more than 43 million people live in a city that has earned an overall medal. That's 43 million people that have had an opportunity to achieve better health outcomes, thanks to the policies put in place by the cities in which they live. You know, every year we've seen steady growth in the number of people we've reached. Since our first assessment, 14 million additional people now benefit from CityHealth's policies. So now I'd like to share a little bit about our new gold medal cities. In the top echelon are cities that have earned a gold in at least 5 individual policy areas. In 2019, there were 8 gold medal cities that achieved our highest benchmark. And today, it is my honor to announce that 2 new cities are joining the ranks of those communities that have earned an overall gold medal. Our first new gold medal city is Atlanta. Atlanta's gold medal is the result of genuine interest and innovation within the city, tremendous local leadership, and most importantly, community engagement. The city is an excellent example of resilient leadership and is a model for cities across the nation. In CityHealth's first assessment, Atlanta earned gold medals in food safety, safer alcohol sales, a silver medal in complete streets, and a bronze in high quality accessible pre-K. Last year, Atlanta earned a gold medal in smoke-free indoor air, thanks to the passage of legislation sponsored by Councilmember Matt Westmoreland, who we'll actually hear from a little bit later, and turned its silver medal for high quality accessible pre-K into gold. Now, Atlanta isn't stopping just with their gold medal. Progress is already underway to implement healthy food procurement and improve the city's complete streets policy. The city is continuing to seek opportunities to become a model in other policy areas. Congratulations to all the local leaders in Atlanta on the city's momentous achievement. Our second city joining CityHealth's ranks of overall gold medal cities is Louisville. Louisville earned gold in part to the incredible leadership in the city's health department under Dr. Sarah Moyer, who we will also hear from in just a little bit. In the first year of CityHealth's assessment, Louisville earned 3 silver medals for smoke-free indoor air, food safety, and high-quality accessible pre-K. In 2018, the city turned 2 of their silver medals, food safety and smoke-free indoor air, into gold, earning the city an overall bronze medal. Last year, the Louisville City Council strengthened its complete streets policy with nearly unanimous approval to earn an additional gold medal. You know, Louisville, like many other communities, has shown its resilience in 2020. Racial justice issues, the COVID-19 pandemic, and other challenges have truly tested the city's leadership. But leaders are taking action. Just last week, Louisville Mayor Greg Fisher announced an executive order declaring racism a public health crisis in the city. City leaders have voiced their commitment to closing racial and health disparities, and we are proud to award the city an overall gold medal. And it's now my honor to recognize Louisville Mayor Greg Fisher.
Hello, everybody. I'm Greg Fisher. It's my honor and privilege to be the mayor of Louisville. This is an exciting day for us. CityHealth has recognized Louisville as a gold medal city, meaning we have earned an overall gold this year in 5 policies: pre-K, complete streets, tobacco 21, smoke-free indoor air, and restaurant grading. It has been a challenging year, to say the least, but our team and our terrific partners have remained focused on our goal of making Louisville a healthier, equitable city. And strong policies like this make the healthy choice the easy choice for our residents. We're proud to share this golden achievement with Atlanta, and I look forward to congratulating Mayor Keisha Lance Bottoms on her city's accomplishment as well. I'd like to thank CityHealth for this gold medal distinction and its mission to provide evidence-based policy solutions that will help millions of people live longer. And a big thank you to our team at the Department of Public Health and Wellness for their unwavering commitment and hard work in our city, especially as they lead us through these unprecedented challenges. We could not do any of this without you. Thanks.
You know, it's always so powerful to hear from local leaders in their own words. Congratulations to all of our new gold medal recipients. I also want to recognize all of the cities earning overall medals in 2020. The team at the Center for Public Health Law Research at Temple University's Beasley School of Law reviews each policies every year and recertifies all policies and medals. In addition to Atlanta and Louisville's achievements, 11 cities have improved their overall medal standing by earning a silver or a bronze for the very first time. First-time silver medalists include Albuquerque, Charlotte, Las Vegas, Milwaukee, and Philadelphia. And first-time bronze medalists include Columbus, Jacksonville, Memphis, Mesa, Nashville, and Phoenix. So I'd like to turn now to individual policy medals, where we also saw substantial growth and celebrated another milestone achievement. Even during such a challenging year, we saw medal gains in high quality accessible pre-K, earned sick leave, and healthy food procurement. However, one area deserves special recognition and serves as a model for policy adoption. For the first time in CityHealth's history, all 40 cities are going to earn a gold medal in a single category, and that is for Tobacco 21. This achievement was the result of locally driven innovation that ultimately became the law of the land. You know, in CityHealth's first assessment in 2017, only 13 cities had Tobacco 21 ordinances on the books, with more joining each year until the passage of federal legislation in December 2019, truly a story of local innovation. As you can see in this chart, not only are cities earning more medals, they are earning more gold medals. While there was a 7.5% increase in overall medals, we saw a 15% increase in gold medals as cities strengthened their policies. For complete report results by city, as well as information on local ordinances that other cities can use as models, please visit cityhealth.org. I would now love to take a couple of questions. Media, you can please submit your questions into the chat box. So we have one great question that asks, what results, if any, were surprising to you? I just want to emphasize, I think it is pretty fantastic that in a year with so many different challenges, cities have still shown a tremendous amount of innovation and of nimbleness. So the fact that we saw real movement in the areas of high quality pre-K, earned sick leave, and healthy food procurement, I think shows that even though cities were dealing with confronting the COVID-19 pandemic, dealing with lots of unrest in the movement for racial justice, they are still providing the foundational building blocks for healthy communities, which is truly impressive. So we have a wonderful question from Maureen Benjamins. And her question is, have you done any research on how city rankings are related to their overall health outcomes? This is a fantastic question. Obviously, CityHealth cares deeply about improved community health for all. And there's actually quite a lot of research related to two specific policies, specifically around tobacco control. For Tobacco 21, which I mentioned earlier, All cities have received gold for that. If you raise the age of purchasing tobacco, you can actually stop kids from starting to smoke before they start, which yields great health benefits long term. Also, smoke-free indoor air, when you provide clean air to not only folks within parks, but also within bars and restaurants, you see great health outcomes for that, as well as we all know tobacco consumption can be the leading cause of death, preventable death. The wonderful thing about CityHealth is that we are really looking at those upstream interventions and trying to provide those building blocks for good health for all. I loved Mayor Fisher's note about how having the healthy choice be the easy choice. That's exactly what we're trying to do. But you won't see some of those health outcomes for years, maybe even 20, 30 years in the future. But that's exactly what CityHealth is trying to do, prevent poor health outcomes before they even start. Thank you all so much for these great questions. We really appreciate the opportunity to address them and really appreciate your engagement as well. It's now my pleasure to introduce Katrina Forrest, my co-executive director at CityHealth, to lead a panel discussion.
Thank you, Catherine. I am thrilled to be joined today by two leaders from CityHealth's newest 2020 gold medal cities, Atlanta and Louisville. From Atlanta, I am delighted to introduce Councilmember Matt Westmoreland. Councilmember Westmoreland is an Atlanta native who began his career by serving the city as a high school teacher in Teach for America. A graduate of Princeton University, he said that his goal for returning to his hometown was to provide kids in his community with the same quality of education that opened the doors of opportunity to him. In 2013, he was elected as the youngest member of the Atlanta Board of Education. And then in 2017, he was elected to serve on the Atlanta City Council as an at-large council member. All achievements realized by the time he turned 30. One of his major accomplishments as a council member was the passage of legislation making the city of Atlanta and Hartsfield-Jackson International Airport smoke-free, which helped Atlanta to earn an overall CityHealth Gold Medal. From Louisville, I'm excited to introduce Chief Health Strategist, Dr. Sarah Moyer. Dr. Moyer is a board-certified family physician who currently serves on the faculty at the University of Louisville. She became medical director at the Louisville Department of Public Health and Wellness in 2015, where she spearheaded the establishment of healthy vending guidelines, expanded Louisville's smoke-free indoor air ordinance to include vaping and hookah products, and created Kentucky's first needle exchange program, to name a few of her accomplishments. In 2017, Mayor Greg Fisher named Dr. Moyer as Louisville's Chief Health Strategist and leader of the city's Department of Public Health and Wellness. In her role, she realigned the department's organizational structure based on the Public Health 3.0 model and is leading the effort to help residents navigate the COVID-19 pandemic. And I would be remiss if I failed to mention that the De Beaumont Foundation recognized Dr. Moyer last year in its 40 Under 40 in public health list for her bold leadership and focus on health equity. Thank you both again for your participation. I am so excited to get this conversation underway. But before we get started, I have a few housekeeping items. There will be an opportunity at the end of this discussion for the audience to ask our panelists some questions. To submit your questions, please use the chat box and be sure to include your name and your organization or affiliation, and we'll get to as many as we can. And with that, I'm going to jump right in. And the first question is for you, Councilmember Westmoreland, and it's a multi-part question. As a newly elected official, why did you focus on public health as one of your first priorities? And what did it take to get the smoke-free indoor air legislation passed in the city of Atlanta? What, if any, opposition did you face?
Certainly. Well, good morning, everyone, and thank you for the opportunity to be here and spend a couple minutes with you talking about the importance of public health here in Atlanta and across the country. Honestly, the idea for for introducing this legislation came from public health advocates, folks from CityHealth and from the American Heart Association and the American Cancer Society, which is headquartered here in Atlanta, came to my office early in my first term and said Atlanta is the only major city in the country without a comprehensive smoke-free health ordinance. And as home to the American Cancer Society, as home to the largest airport in the world, or the busiest airport in the world, we need to join the rest of the country in having this type of legislation on the books. And so I was honored to introduce legislation with a majority of my colleagues on council. Faced some opposition, but I think it was a great example of working with public health advocates, small businesses, making the busiest airport in the world smoke-free, bringing Atlanta up to the rest of the country. And then the final piece that was really important to me as a former high school teacher was making e-smoking and vaping illegal in Atlanta. It's an epidemic among teens in this country. And for the city of Atlanta to send a message to our young folks that this is dangerous and it's not good for you, and we need to make sure you don't ever start so you don't need to stop, was really important to me.
That's great. And I'm actually really glad to hear you talk about the partnerships you established with public health advocates, with businesses, because I think that cross-sector collaboration is critical, particularly as the pandemic we know has exacerbated longstanding inequities. There's just a lot happening. It's going to take all of us to kind of pool our resources and offer our unique and diverse perspectives to address some of society's most intractable problems. So I love that commitment to really engaging the community and having that cross-sector collaboration. As a follow-up to you, I'm curious, what advice would you give to mayors and or council members considering adopting similar policies that might be up against some of the same opposition you referenced you were up against with smoke-free?
Yeah, so I think the recipe for success here in Atlanta, at least, was to receive an idea, either to think of it on your own or to receive it from advocates in the community. And then we were very intentional at a colleague, Andre Dickens, and I, who worked very closely to pass this legislation, and taking the time to talk with every member of council before introduction, taking the time to talk with people who might be opposed, bar owners, restaurant owners, cigar bars and hookah lounges, different constituencies at the airport, and being proactive in talking to people who are going to have thoughts either positive or negative on this. Listening to people who have concerns, addressing them as best as possible, but then at the end of the day, standing firm and making a clear argument to the public about why this is important to the health of our city, and that it's something that we're going to get done no matter how hard it takes.
That's great. And sort of staying in this vein of coalition building, community engagement, I want to turn to you, Dr. Moyer, because as Louisville's chief health strategist, your role really does involve engaging all parts of the community to implement bold and innovative ideas, like the policies that Louisville has adopted from the CityHealth package, as well as like implementing Kentucky's first needle exchange program. And I'm curious to know, what is the biggest challenge when it comes to getting community buy-in on a bold new idea, and how have you specifically overcome it?
Great question. So some of the biggest challenges that I've come across are people's mindsets and beliefs on what it takes to improve health, and then even how government should work and what's needed to advance public health, how we should be prioritizing funding. To overcome a lot of these challenges, we really work hard to try to change and reshape the narrative on it. Often means challenging what people think that is truly needed to advance public health. For example, behavioral change programs aren't enough. We need policies, like you mentioned, that shape the context of people's lives and the opportunities that they have. Or how the mayor said, and we like to say, the choices people make are shaped by the choices people have. And how can we make the healthy choice the easy choice? So one of the things we've done is publishing our health equity report. Every 3 years, it describes the linkage between systems of power, root causes, health inequities we see. Documents are based on extensive research, which helps us to enable a reputation of trust and data-driven decision-making. And we hope that this, and we think it helps us to be viewed as a trusted resource for decision makers on health in the community as they're debating what policies they're going to bring forward. And then finally, as you mentioned, it involves a lot of intentional relationship building, not just with our policymakers and decision makers in the community, but also our community partners that know these issues in and out, as well as the grassroots organizations that have a lot of advocacy power in the community, and just helping them provide the data, helping prioritize, and trying to see which ones can work and we can get through in our city.
That's excellent, and I was glad to hear the reference to health equity. It's a topic that is top of mind for many of us, and I'm curious, how important is it that local leaders, businesses, and members of the community have shared language around equity and what it means, and how do we go about developing that common language?
I think it's important for people to understand the issue and why that they're there and the systems that have been in place for a long time. And that's what's been a silver lining of COVID and other things happening in the community has really highlighted the inequities that are in our systems, not just for health, but for every outcome of life. And we know that all then plays into health. And so my goal is for everyone to live a long, healthy life, but we need every area of our community functioning equitably in order for that to work. So yeah, I think changing the language is really important. Everyone having the same tools helps a lot, and just knowing what tools are out there too. Health impact assessments is one tool that we use a lot here in Louisville, and allows us to use research to understand how a policy is linked to various health outcomes and whether it's going to have a positive or negative impact, and what can we do to improve the policy so it affects everyone more equally or improves the lives of more people. And that's just one tool. We like to use a lot of tools, whatever tool might work in that situation, but just helping us to get healthy, equitable policies moving forward.
That's excellent, and actually tees up my next question, which is to both of you. In your roles as a council member and a chief health strategist, what strategies and tools can help local leaders recognize and ultimately eliminate the social and structural injustices that result in health disparities? So I'll take that over to you first, Councilmember Westmoreland.
Sure. So, before COVID hit, Atlanta already had the widest income inequality and among the lowest social mobility rates in the country. And that's something that I think about every day. I chair our Community Development and Human Services Committee on council, and that's the body that oversees all of the city's work around housing affordability and economic development and workforce development, which I think are all actually public health issues, right? We face tremendous housing affordability challenges in this city and need to address them through policy, through passing a housing opportunity bond. We've done a lot of work with our economic development organization around changing its direction, not just focusing on the recruitment of Fortune 500 companies and bustling parts of town, but being really intentional about how we can recruit and create high quality middle wage jobs that pay $40,000, $50,000, $60,000, $70,000, $80,000 that allow our residents to continue living in neighborhoods as they become more expensive. But also, when you have a job that pays a living wage, that improves access to food. It allows us to move grocery stores into parts of town that are food deserts. It allows us to connect residents to high quality medical care. And so, I think sometimes when people think about health, they might think about some of the things that are on your list, whether it's healthy food procurement or people not smoking. But I actually think that almost every issue we tackle with. That's why I like to see complete streets on CityHealth's chart, is that directly impacts the quality of life for our residents, the health of our residents. And I appreciate the metrics that you all create and kind of set a target for folks to reach. And I'm excited that Atlanta has hit gold on the ones that we have so far. And you already mentioned that we're having conversations right now about how we can add a medal with healthy food procurement and move our silver to gold with complete streets. And then on issues where we might be preempted by the state, which happens from time to time, figuring out creative ways to support our residents and our employees as best we can to help improve outcomes for everyone.
Excellent. And I appreciated the acknowledgement that health is everything, because it is. And I think we have to be far more intentional in how we talk about that into the community. I think so often people perceive health as what happens in a doctor's office, and it really is education and complete streets and access to healthy food. It is everything. And to your point, I think we need to be just far more intentional in drawing those intersectional linkages. Dr. Moyer, same question to you. What tools or strategies do you believe local leaders should use and recognize to eliminate the social and structural injustices that result in health disparities?
So I think first, just having a good historical analysis to kind of understand how systems of power like racism, classism have had a huge impact on decision making and policies that have been put in place and practices that we currently have, like what's happened in the past, and try to recognize things that are happening now that you don't think twice about. Things like redlining, or where food can get delivered, or the price of groceries in different neighborhoods. All that impacts health. And then also having the ability to work collaboratively with community, particularly those most impacted, as you develop and implement policies. We do a lot of focus groups, a lot of outreach to community, trying to make sure new voices are at the table to try to help move things forward and make sure that we're not missing something either. I've got my own life experiences, which are different than others, and bring a perspective to the table, but we need more. And then I guess finally, just knowing that this work requires innovation and new ways of thinking. And so health, I get more excited about bringing the health voice to the table for those policies that people don't normally think about with health. So whether it's complete streets or pre-K, we know that those impact health even more than the healthy food. And so it's exciting to bring that new lens to issues that others have been working on a long time. And so being able to bring that health data to our environmental groups that are pushing for complete streets, I think really help kind of put those policies over the edge and is letting us have a healthier community here in Louisville for the future. I'm so excited about that.
That's excellent. And I appreciate you surfacing data collection, because I feel like it is critical, not only data collection, but data dissemination, making sure the public has access to it so that we can surface deficiencies, identify needs, and help city leaders to target resources accordingly. So thank you for that. Another question for you both. What opportunities do you see in your cities to build health equity, both into new policies as well as existing policies?
I can go first. So with COVID, we've really seen an increase in understanding of what it really means for people to have their basic needs met. It's one of the silver linings, I think. So it's really helped to illuminate what we've been promoting through our Center for Health Equity and our Health Equity Report for almost the last 20 years here in public health. And then with the summer's racial justice movement, we've seen many positions of power more seriously reconsidering what it means to be anti-racist, or at least what the true history of racism has meant for our country. And so that we believe health equity is necessary in every policy. So we work with local and state legislators on policies directly and indirectly related to health, like I've mentioned. So like the last year, I was working on multiple legislative pieces. One of the big ones was House Bill 129 in the state of Kentucky that expands public health funding. And that's going to be huge for us going forward. It was huge pre-COVID, and I think COVID's going to help lift it. It's shown the benefit of public health even more. And so I think we're going to be in better shape moving forward here in Kentucky. But then helping to support expungement policies, Pregnant Workers Act, as well as revisiting our tobacco policies, like you mentioned, adding just this summer or last month, we were able to look at the density of vape shops and requiring licensing for anybody having tobacco policies. And so we continue to move things forward and all that, really looking at health equity in that and how policies and where, I mean, that was the vape shop one was just seeing where tobacco was being sold in the community. We don't even know right now because we don't have a licensing process. So just taking those things into consideration and help us gather that data to make better decisions moving forward.
No, I think,
Great. It sounds like there's a lot of great work underway. Go ahead, Councilmember Westmoreland.
yeah, no, I was going to say that I think that the last 7 or 8 months have also shown a bright light in parts of Atlanta's framework that we had started to talk about, but that COVID has really, it is incredibly unfortunate that it has exacerbated so many of the challenges that we were facing, but it's also forced folks, whether it's our mayor or members of council or people in our business and philanthropic and civic communities, to really wrestle with seeing the challenges that we face that have gotten more severe over the last 4 or 5 months. And I think that there's an opportunity as we move into 2021 to kind of harness what I think is a better understanding of more people that maybe didn't exist 6 or 7 or 8 months ago, on how we can continue to stay at the table. Whether it's the United Way or the Atlanta Regional Commission, there are a number of different foundations who have been giving out emergency grants to hundreds of organizations in Atlanta related to COVID. But once we get to a spot where so many people have vaccines, not letting folks get up from that table, but continuing to say, all right, we're here. We've still got really serious challenges. We've still got incredible gaps that exist racially and socioeconomically in Atlanta. How can we continue to work together as we have in this immediate emergency to make some meaningful progress on longer term, more systemic issues?
That's great. And I do want to stay on this topic of COVID-19 and really talk about city resilience. Obviously, the fallout from COVID-19 has been unyielding. As cases continue to soar, we've lost countless lives. Cities and states face bleak fiscal outlook. And the pandemic, as we've said, has exacerbated longstanding inequities. Still, in the face of all of these challenges, we at CityHealth have seen countless examples of cities providing critical health leadership and communities showing incredible resilience in the face of this adversity. And so I'd love to hear from you both. And Dr. Moyer, I'll go to you first. How has your community in Louisville shown resilience during this pandemic? I'm sorry, Dr. Moyer, you are on mute.
I was saying that our communities have been extremely resilient, many foregoing normal activities in order to protect themselves and their families and their community at large. Our public health and healthcare workers especially have shown immense dedication, putting in hours above and beyond the regular duties, being on the front lines, problem solving, evolving stressful situations every day, not being able to kind of put COVID aside because it is their job, both home and at work. So we've seen our communities experience unprecedented stress, emotional, physical, and economic. I think two that really stand out is one of parents trying to juggle responsibilities, working and caring for their kids, making sure they continue to get quality education, but also navigating working from home or childcare if they have to go in. But we've been able to support them with the health department through advocating for grants for daycares and NTI. NTIs are non-traditional instruction, our virtual school hubs through partner agencies like Metro United Way and Evolve 502, which supports our school system. I think additionally, our Black and immigrant and residents of color have experienced disproportional levels of cases and deaths, and even especially younger deaths than our white population. And this is due to root causes such as employment, not being able to socially distance, all the same things that cause the same inequities in diabetes and police violence and everything else that happens. And so we've seen them, residents and leaders in these communities, really step up and help us with creating and disseminating communications, developing targeting testing events, and we've been able to support them through grants to organizations providing financial assistance that might not have been able to happen other ways. So it's really, I think the resiliency has been the community coming together, fighting together, and hopefully with that, we will overcome COVID together. And it's been another silver lining despite everything else.
Absolutely. Councilmember Westmoreland.
Yeah, so it has been both heartbreaking and heartwarming to watch Atlanta residents persevere through some really, really difficult situations. The first example that comes to mind is how the school system used to serve on the school board. And last spring, when everything shut down, the school system leapt into action and for months provided tens of thousands of meals on a daily basis to Atlanta families who otherwise would not have had access to food, since so many of them got 1 or 2 meals a day from going to school. The city's worked with our own general fund dollars and then with CARES Act money to provide tens of millions of dollars in rental assistance to residents, support for small businesses, support for food programs, testing. We've gone so far in our advocacy of strongly encouraging our residents to wear masks that we actually got sued by a governor who felt otherwise. And so it's been encouraging to see folks, even through really difficult times, not let it break them. And I'm hopeful that as we move into a really delicate winter, that we'll be able to move into 2021 in a stronger position and able to help as many residents as possible kind of look to the future and get over the obstacles that have been put in their path, in addition to all the obstacles that existed before March of 2020.
I just want to thank you both for your leadership, because I think seeing that resilience really starts at the top. If folks are struggling, but they see that their leaders are fighting for them and pushing for them, it gives them some hope and gives them something to hold on to. And so I'm just very appreciative to you and all the local leaders across the country for the work that you all have been doing in these truly unprecedented times. As we brace for a vaccine, and news broke this morning that a 90-year-old woman received the vaccine today,
Yep.
New questions emerge around who will receive it in light of limited production, and how will we ensure its equitable distribution. And so given that, coupled with everything that has transpired in this year as a result of the pandemic, what is the biggest challenge on your minds as you look to the next phase of COVID? Dr. Moyer, I'll start with you.
I think our biggest challenge is going to be sustaining our current level of response and adding in the responsibilities of vaccination. Many of the responsibilities are going to fall on workforces that are already at capacity. And so just one thing we're trying to plan for, and using those great skills that we've used in everything else with data collection and community collaboration in order to make that happen. I think the other one is the virus is continuing to negatively impact individuals and businesses. And we just really hope that there's a much needed economic relief to kind of help us get us through this last push until we can get the vaccine out and saving more lives.
Yeah, the 3 things that come to my mind are: 1, hoping that Congress acts this week on some sort of relief package to get dollars where they need to be in the hands of local and state governments and small businesses as soon as possible. The second is I've been reviewing data around the percentages of different subgroups of Americans who are inclined to want to receive or not receive a vaccine, and just making the message as clear as possible that this is absolutely something that people should do. And then to your question, though, making sure that the vaccines that are available as they come online are going to the folks who need them the most, who are most at risk, which is not always the way things work out. And then the third is evictions, whether it's been local at the city or the CDC putting moratoriums on people being kicked out of their house. All of those will start to lift in the weeks ahead. Some of them already have. And just the wave of folks who would be eligible to be evicted from their apartments or who might face foreclosures for not paying their mortgages is going to be really challenging and something that we all need to keep top of mind over the next several months.
Absolutely. Thank you both so much once again for your participation. This has been a truly insightful discussion, but I do want to make sure that we get some audience questions in. So as a reminder, please submit your questions using the chat box and include your name and organization or affiliation. So staying kind of in the same vein that you were just speaking about, Councilmember Westmoreland, there's a lot going on. If folks are concerned about their housing or any other situation, that adds to their stress. And there was a stress survey completed earlier this year that found the rate of depression had nearly tripled since the start of the pandemic. As COVID has taken a significant mental health toll on many Americans, I'd love to hear from you both. If you could speak to the efforts that you're championing or prioritizing in your cities to address pressing mental health needs. I'll start with you, Councilmember Westmoreland.
Oh, I'm sorry. I was waiting for Ms. Moyer. So we have a new chief health officer here in the city of Atlanta. And one of the conversations that has started around that appointment is that, I think that mental health for a long time has been something that hasn't actually been discussed very much at the city level. It's been more of a conversation at the state and the county. And so I'm hopeful and encouraged that I think that's starting to change, and it's starting to move, much like health is intertwined in all of the different topics, including ones that we might not necessarily think about. I think the same is true for mental health, and it needs to and is becoming more interwoven into conversations that we're having, and how we can address that issue at the kind of municipal level while working with our partners at the county and at the state, who've been pushing on that topic for a long time.
That's excellent.
And for us with the health department, I mean, deaths of despair was our number one issue pre-COVID. And so a lot of our energy, using the same partnerships and everything that we've been doing to address COVID, energy was in that realm. So really trying to address homicide, suicide, and overdose. And those programs have not gone away, and still trying to tackle those issues. I think some of the more, if you look at the social ecological model or our health equity report focusing on the individual, we've got great things like Lift Up Blue, like trying to get people to exercise and connect, those sorts of things. And then we're trying to get mental health resources out there. We've been able to increase the number of people that we're seeing in our syringe exchange program, increase the number of people that are getting into our methadone program, more naloxone doses getting out. But then also the same things that we're trying to tackle to prevent COVID also will help with mental health. And so working on like the policies in CityHealth will also help with that. And we know preventing COVID too will help. I think there's a study out that showed that people who've had COVID, 20% have worse depression and anxiety kind of post-COVID. And so the more that we could do to prevent people from getting COVID in the first place, I think will help with that in the future too.
Absolutely. Let's see, I think we have a question that's just come in. Yes, so we have a question from Isha Yardi, who is with the De Beaumont Foundation, who is asking, what challenges do city leaders face when trying to prioritize what public health issues to address? Are there specific criteria you turn to in order to make those decisions?
That's a good question. Resources is often a challenge. We spoke a little bit earlier in the conversation about the financial strain that COVID is placing on local and state governments, and Atlanta was fortunate to have a pretty hefty reserves or rainy day fund, which we have tapped pretty extensively in the current fiscal year to try and not cut services. But I'll tell you, we were having a conversation about passing a $200 million housing bond last March and April, just as COVID was getting started, and we had to press pause on that. And the conversations have restarted, and I think we're optimistic that we'll be moving toward at least a $100 million bond here in the next couple of weeks. But the concerns about whether or not we would have the resources to pay the debt on a initiative like that has kind of caused us to pull back a little bit. And we're in pretty good financial shape. I know that there are cities and states across the country that are in a lot more dire situation than we are. And so I think that, as we navigate the current financial situation, that resources is always going to be a question. I'll piggyback on that by saying that budget should reflect your values. It is incumbent on all of us to make sure that we're spending our dollars as effectively and as efficiently as possible, but also that we're spending them on initiatives and programs that will help bring about the change that we've just spent the last 30 minutes talking about. And so it can be a challenge for sure, but you also have to keep pushing until you get to a budget that reflects your values and is going to move your people forward.
Excellent. Dr. Moyer, anything else you would like to add there?
Yeah, and then just trying to compose my thoughts here. So we prioritize kind of based on what the data and then what the community wants. So with health departments, they do a community health improvement plan for Louisville. It's our Healthy Louisville 2025, and that starts with looking at the data. And so for us, that was our health equity report, just looking at the different data outcomes across the city, who's experiencing what and how. And then we combine that with like a year of community listening and a community health survey to see what the community cared about, and then doing focus groups to kind of narrow it down. Louisville picked 4 categories, one which is building healthy neighborhoods. That's where Complete Streets policy kind of came out of. And that was step 1 for that group. Achieving environmental equity, looking at air pollution across our city and how do we improve that. Some of the tobacco policies came out of that. And then ensuring equitable housing and creating healthy schools were the last 2. But really it comes down to the data and what the community feels will improve the health and what they're really willing to get behind to advocate for and join us in the fight. So, there's so much to do. And so that's why we really appreciate CityHealth kind of helping to prioritize and seeing what them also, you guys looking at the evidence as well with us. And it's a great tool to use to get started if people are overwhelmed.
Thank you, Dr. Moyer, for that nod. We hope to provide a framework to city leaders, and so I'm glad to hear that you have found that useful. And I want to pick up where you left off, Councilmember Westmoreland, in that budgets truly are pronouncements of values, and I'm sure you'll appreciate this. I spent 6 years working for an at-large council member in DC. I know the challenge of trying to prioritize competing needs and demands unlimited resources, but I appreciate you saying you still need to prioritize and make those critical investments where feasible. And now is not the time to disinvest in the things that we know, to Dr. Moyer's point, there's good evidence for. And so I really appreciate you saying that. So thank you both. Just in the interest of time, I will start to wrap up and just say, I know 2020 is coming to a close and we still have a long way to go to defeat the pandemic and tackle some of the big public health challenges that we've started speaking about today around health equity and strengthening our public health infrastructure. But I don't want to end on a sour note. So I'd love to hear from you both. What is one thing you're optimistic for in 2021?
I go first. I think one is having a vaccine. I think it's been impressive how quickly that medical research has come through. Also hopeful for a more coordinated federal response, both in messaging and tactics in addressing COVID. And then also seeing the importance of investment in public health. I'm hoping that will be a problem that'll be solved forever going into the future. And then finally, I think first step to fixing any problem is acknowledging it exists. And I think COVID has really highlighted the inequities in every system and how connected we all are too. In order for everyone to thrive, we all have to be able to thrive. And It's not improving someone's health at the expense of someone else's. Like, we need all of us to thrive to move forward. And so I'm really hopeful that's going to lead to meaningful systems changes and longer, healthier lives for everyone in our community.
And I'll zoom in. I agree with everything that Dr. Moyer just said. And as I think about 2021, in addition to the housing and economic development and workforce development stuff that we've talked about already, Atlanta is going to be undertaking a conversation around greater protections with our tree canopy. It's been 20 years since we updated our tree protection ordinance, and we're called the city in the trees. I think that's actually also a public health issue, making sure that we continue to protect our trees as we grow more dense and grow period in Atlanta. And then secondly, trying to make some good headway on the goal of having every Atlantan within a safe 10-minute walk of a quality park, and thinking about ways that having access to nature and parks and green space, also whether it's helping with mental health and stress or your physical well-being, I think are things that are coming up on the Atlanta scale in 2021, and I'm excited about those conversations, figuring out how they fit into CityHealth's kind of next round of expectation setting for cities across the country, and would encourage you to keep setting those goals higher, because I think they push cities like Atlanta and Louisville to keep attempting to reach those goals, which in the end helps our residents. So thank you for all you all are doing, and for the invitation to spend some time with you this morning.
So thank you both so much. You've truly been amazing panelists. Thank you for your leadership. I think I am encouraged by city leaders like you across the country, as well as communities that have really persevered through some difficult times. I also want to thank all of the participants who joined this discussion.